Kind of growing up, I always wanted to be in some type of public safety, just the way everybody comes together and works together.
Started volunteering when I was in high school, and I really just fell in love with it and the whole brotherhood and everything.
I mean, I wanted to do something where I felt like I was making a difference, where whenever it boils down to it, something that's essential.
I just remember going to the call, like Brad telling Dave, because he was driving, just to take it easy because you feel the wind blowing, that roads were slick. I mean, there's just debris all over the place.
I jumped out the side, just like any other scene, really. Remember running past Dave, he was going to the back of the truck to get cones or flares or something. Heard Brad yell, and I thought he was yelling for somebody up front.
Heard Brad say something first. I looked back and saw the semi coming, so I just immediately turned and just jumped.
I remember the impact. I remember getting hit.
It was almost like a loud noise, and I was just out. I just passed out from pain. And when I woke up, I was like in between the engine and the tractor trailer. When he yelled to move forward, probably saved me, because otherwise I would have been ran over a lot further up.
I mean, it definitely saved my life, because I've been just right in the middle of traffic, whatever.
That's the definition of who Brad was. He was a selfless leader, a selfless husband and father, and I know that he put the needs of his guys before his own.
Then I could hear the medic was pulling up. I could hear him say "Mayday, Mayday, Mayday" or whatever. Engine 6 had been hit.
Hanover County had a fire engine that was hit in the rear by a tractor trailer. I don't know how many patients you're going to have right now, but I'm bringing you the first one.
So when the first call comes in, we assemble around the trauma bed. We'll have our senior resident, Dr. Flores, go to the head of the bed. The trauma surgeons kind of go to their appropriate sides, and the attendings take, a position where they can supervise the best.
Dr. Ferguson, before anybody got there, kind of got us together and said, "I just want to let you guys know there was a fatality." So right off the bat, we were just kind of shaken up, and it wasn't just close to home for us. I mean, it was home. These were our brothers.
And I come to the nurses area where they're set up. Rachel tells me that it's a firefighter, and she knows that my husband is a firefighter, and at that point we didn't know much about anything.
We kind of made a plan as to how we would triage these patients. When Dave came in, he was maintaining his blood pressure, but he was complaining of abdominal pain, chest wall pain, and also a lot of pain to his right hip and his right lower extremity, his right leg. The other patient, Carter, had a pretty remarkable wound to his right lower extremity that indicated that it was essentially crushed.
I was impressed and surprised when Carter's team that brought him in were so thorough and professional, and it was a complete, perfect handoff from EMS.
We know that certain patients are critically ill, that their acuity is high, and that you just have to kind of push that aside and understand that you're taking care of someone's life, someone's brother, someone's father, someone's husband, and that you're trying to do what's best for them.
We're constantly communicating throughout the whole process. As far as the doctor's perspective, we are minute to minute with every change. While we're at bedside, everybody's aware of what's going on.
He had a pretty severe injury to that right leg, so ortho came to the bedside and quickly started to assess that as well after we did our initial assessments.
Our job was to find the injuries we couldn't see, and the same thing for firefighter Johnson. Concentrate on everything else, find what can kill him sooner.
We kept him as comfortable and as calm as possible, but also making sure he remained hemodynamically stable, that his blood pressure, his heart rate, his breathing was all okay.
Dave was maintaining his blood pressure, so we began blood transfusion, and we decided to get more imaging.
And I remember stopping the CT scans because his pressures were dropping, and I just went in there and I put the lead vest on, and I just, while he was getting his scans, I'm just squeezing this unit of blood into him, and, I wasn't gonna let him die on that CT table.
He had one of the worst associated both column pelvis fractures I've ever seen. He had a very bad common femoral shaft fracture that had impending compartment syndrome, meaning basically the swelling got so thick in his thigh that it was cutting off circulation to his leg.
Our trauma team has already taken full responsibility for that patient, and they know who has been called, who's been involved.
I mean, in cases like this, the handoff's sort of simultaneous. Everyone that needs to be there is there in the very beginning. It was kind of fluid. Once the decision was made, Dave went to the operating room.
And then we just have a quick handoff in the OR because, of course, by the time we get there, they have a heads up and they're ready to work. I mean, they're ready to do what they have to do to save his life, and it happened just like that. It was quick.
Usually we want to prioritize maintaining stable vital signs. He had multiple injuries where he was bleeding from. He had liver injuries as well as pelvic fracture and a really severe femur fracture.
After Dave came back from the CT scanner, we could see that he was no longer maintaining his blood pressure, and it was fairly obvious that he would need to go to the operating room. So I consulted with our orthopedic surgeons, and we made a decision that we would just meet them in the operating room.
I think Dr. Anand did a great job that night because when I came in that morning, he was really stable.
The doctor came in and was telling me about my leg, telling me all the bones and everything, my ankle on the ball, my ankle were destroyed.
Carter had, unfortunately, what we refer to as a mangled extremity, where there was pretty severe muscle, bone, and nerve destruction, such that through consultation with our orthopedic surgeons and Dr. Perdue, we thought that salvage of the limb was not going to be fruitful and may even make Carter sicker.
And then he said we could try to repair it, but it'd probably be like 20, 30 surgeries, 2 years worth of, and it'd be chronic pain for the rest of my life. I wouldn't be able to come back to working for the fire department just from pain from walking. He said we're probably just gonna have to amputate. And I asked him, I said, I'll be able to get a prosthetic and everything right? Just made up my mind then, went back to sleep. Looking what happened to my foot, like, I'm okay with the decision. I'd still probably be in the hospital fighting sepsis or something right now if I didn't amputate it.
He had to go to the operating room multiple times for his pelvis. So coordination with orthopedics was every day.
Stop the bleed, he's stable, go back into the OR.
It's constant communication between both teams.
Anything that hit you on the chest, heart and lungs, they got major problems now. We gotta monitor your heart. There's so many things that can take your life right away. So that's a minute by minute, constantly monitoring the patient.
He had to go back to the operating room to get multiple washouts and then finally get an internal fixation of his pelvis as well as his femur.
You know, sometimes we gotta involve all the teams, cardiac, neuro, and all that, and they're coming. They don't know the whole thing about the patient. I need to know everything about the patient at that moment.
There's a number of people that were involved in his care, and we do this every day for all of our patients.
When Dave was on our unit, he was pretty stable. A lot of his struggles had to do with like pain and mobility and just kind of relearning how to be himself while also coping with the trauma that he had to endure.
Dave wasn't able to use his right leg. He also had a clavicle fracture, so it was too painful to use his right arm. So we really only had a left leg and a left arm.
Rolling over to my side was excruciating. I couldn't do it, so I had to get like 4 people to help me with that.
So kind of looking at that, talking to the bedside nurse on how he was doing with moving in bed with them, how do we coordinate pain medication, and then if we were going to get him up in the chair, what plan could we leave the nursing staff to get him safely back to bed if we weren't there?
Physical therapists came in, occupational therapists came in, and they really pushed me to do things that I felt like I couldn't do.
You know, what did he want to work on, and what were the ways we could get him safely out of bed? Because he was very interested in getting up in a chair and getting out of the bed.
So just from going from that to sitting on the edge of the bed with my feet dangling and holding myself up, just eased it in, but they really kept the pressure on.
Carter was young, he was strong. He was in a lot of pain, and our job then was to help him define a new you, because he was not going to be the same. So the main thing that we did was wound care and pain relief.
And all the nurses and everything in the room, they were really supportive, awesome. Like, they'd be giving me IVs and medicine, just talking to them really helped. A lot of the ortho docs, they would come in and talk to me about, you know, the process it takes to get a prosthetic, because that was all I was worried about then.
But on the other hand, as he progressed and he could do more for himself, I know that he had a lot of pain and he had a real hard time. He didn't want to stand up.
And then he had a neomobilizer on the residual limb. He had transtibial, so he was able to, get a prosthetic in the future. Just really pushing each day. It was almost like a challenge, really, really pushing.
And it was quite amazing, because after he did, he stood. That's all he did. He stood, he sit back down. And from that point on, he was like moving forward, running. You couldn't keep him down.
And since then, I mean, it's been so quick how much better I've gotten. And now I'm going out there and they're kicking my butt.
So my major thing here is trying to get him stronger. Well, he still has some weakness in his right leg because of all the injuries. So we're working on strengthening his leg. He has a lot of weakness in his foot because he has foot drops. So we're going to be working later on trying to increase the strength of his foot.
It's been awesome. I mean, everything we've been doing, I mean, even if I hate it, it's helped me.
I owe it all to them. I mean, I couldn't do it without them completely. Even now, like the doctors and physical therapists I go to and see, all of them are helping me, being supportive, telling me the steps I gotta take to get back to riding on the truck.
There's a lot of really hard work on everybody's part. A lot of pushing me to do things that I didn't think I would be able to do.
It's a testament to the way that people come together.
That night, we were able to extend our hospital family to theirs.
Their outcome is the result of the efforts of many people. It's really a testament to the way that people work together.
That to me helps to know that level of support that we can provide to them helped not only Dave but the entire extended family.
We are absolutely blessed to have such a wonderful trauma center in VCU. I know that if there was anything that could have helped save Brad, he would have been in good hands there. And I firmly believe that that's one of the reasons why our guys are recovering so well, is because the qualified doctors and nurses that they had attending to them. So the fact that they are on the road to recovery and doing so well is, for me, I'm able to take a deep breath and to know that with healing and time that we're gonna all be okay.